Hi, thank you so much. My name is Fred Diamond. This is the Love, Hope, Lyme podcast. If you're listening to this on Apple Podcasts, thank you so much. Give us a 5-star review. Or if you're watching on YouTube, thank you so much. Give us a thumbs up. Leave a comment. This is a special episode. You may listen to our episode that we recently did on medical gaslighting, and you were introduced to Jenna Luché-Thayer, who was one of the guests, along with Jennifer Fagan and Jeremy Shelton. They wrote what I thought was a tremendous report called Medical Gaslighting and Lyme Disease, the Patient Experience. So on that show, we went into some detail on what is medical gaslighting, why is the Lyme community affected by this so much, what were the results of the survey that they had done. And Jenna did a great job talking about some of the relevance of gaslighting to Lyme disease. So I wanted to bring her on for a special episode to focus on that specifically. So Jenna, it's great to see you again. Thank you for being on the previous episode again that we had done with Jennifer and Jeremy. And again, we'll put some notes into the show notes about where people can download the report. It's an eye-opening report. It was published towards the end of 2023 and had got a lot of attention in the various Lyme Facebook groups and other communities. So thank you so much. And we want to explore a little more about your angle on this and some of the history about why medical gaslighting is so deleterious to the Lyme community. So, Jenna, give us a little bit about your background in the chronic Lyme community.
Let's see. Thank you for this interview, Fred. And basically, I have a professional background of working in the area of accountability and transparency on how government works or does not work. Transparency and accountability is the flip side of corruption. So we want to have and promote transparency and accountability in governing practices. And the other area of my specialization is human rights and the marginalization of particular groups historically and currently. So I've devoted decades to this level of work. And in 2012, I found out that I was personally a member of the marginalized patient community of Lyme disease. And so I decided to employ my skills to try to bring about some changes to address some of these critical issues that we are facing.
All right. So again, you were very active, as we talked about on the previous show, in having the World Health Organization change the medical codes for Lyme disease. Not many of our listeners are going to understand what that means. So please explain what that means and why it's important.
It's very important. The World Health Organization has 194 member nations who are participating in all of its activities, including the development of medical codes that are used across the globe. And this has been going on for many, many decades. It's not a new phenomenon, but many people do not realize how these codes are linked directly to how insurance recognizes and reimburses their medical care, and how governments track diseases. And so if you do not have a code for a particular illness or disease or medical condition, it's very hard to get the recognition, research, and financial support, insurance support, Medicare, Medicaid support to take care of the illness. And I'll give you an example. Ebola did not have a medical code until 2016, when Ebola threatened the entire globe as a pandemic. Prior to that, it was just an orphan disease found in only certain countries, and so it was not deserving of a medical code. It was, of course, deserving, but these codes are very political in nature as well, because healthcare systems are both political and economic systems, as well as medical delivery systems. And Lyme disease has been stagnant for more than 25 years with codes not changing, and since it was basically discovered and brought into the World Health Organization medical codes. So I formed an international organization, a nonprofit, all voluntary, and we petitioned the World Health Organization and documented the science as well as the human rights violations related to Lyme disease. And they expanded the codes tremendously to include multiple medical conditions that are caused by Lyme disease, including dementia, demyelinating conditions, Lyme carditis, all the ophthalmic complications from it, the fact that it's disseminated and can attack any organ. All of this is now part of the medical system that's being integrated across the United States and other countries. And so people understand the importance of knowing their codes and bringing these codes to the attention of their medical providers. That means that the medical providers understand these codes have been validated, and it greatly helps to validate the multiple complications and chronic conditions, disabling and possible potentially fatal complications from Lyme disease.
Wow. Congratulations on getting that achieved. Just curiously, is that work done? Is all the codes in place that need to be in place?
There was a delay in integrating the codes because of the pandemic.
Hmm.
So they were supposed to be launched in 2021 in the United States, and they're only now being integrated. And different countries, even though they were ratified back in 2018, after ratification, it takes a couple years to basically pull them into the digital system that we use. And different countries have different digital systems, and then different countries have a uniform practice of reporting trending disease to the World Health Organization to help track changes in disease patterns. So it takes a while for all these bureaucracies and governments to integrate them. So we're currently in the process of integrating them in the United States and elsewhere.
Wow, good job. Explain how medical gaslighting relates to a human's rights, and how are human rights violations addressed?
Yes, well, that's a very complicated question. But basically, when we were preparing our documentation to present to the special rapporteurs for health, human rights, and the human rights defenders of human rights at the United Nations, and also to the World Health Organization, we found that across the globe, there were 14 different human rights violations across 11 international and regional treaties that were in violation. I mean, that's quite a serious and broad finding. And it was across the globe. Wherever we looked into it, we had representation from every continent in our group, and getting documentation from every continent. So once a report like that is submitted, then all that can, the World Health Organization and other nations, once that kind of information is provided, they can ask countries to start reporting on it. For example, violence against women was never considered a human rights violation. You know, it was kind of just a cultural practice. But I helped to get it codified as a human rights violation. And so every nation had to start reporting on rates of violence against women, which then brought it up to the attention globally and engendered a number of protective laws to protect women against violence, to in fact create punishments for the violators, et cetera. So prior to that, it was happening, but there were no mechanisms to address it. Once it gets into the system, there's a requirement to respond. Now, will the response be slow or fast? That will depend on many different factors, but at least now it's registered, and nobody can say, it's just an issue with that patient group. No, it's actually documented as human rights violations.
That's insane. It's insane that it has been going on, and it's insane that it had to get to that particular point, that this is revolved around a disease just because you were bitten by a tick.
Yes, and it's when people, to give some very concrete examples of what kind of human rights violations are ongoing. There are many, like I said, 14.
Yeah.
But for example, one of the key human rights is the highest attainable standard of health. And if you are being denied diagnosis and you are being denied treatment, you are clearly your health human rights are being violated. There's also the right to information. Or if you are being told, as in a gaslighting situation, that you are not sick, when in fact you are infected with the bacteria that's going throughout your body, your right to information is being denied. If you are a Lyme patient who has been told that you are not only are you not sick, but we think you need to go into psychiatric care, and you're forced into a psychiatric care, then your personal security, which is also another human right, is being violated. If you are the parents of children who are sick with Lyme disease, and they take your children away from you because of their absences from school, then these are also another whole sets of human rights abuses and violations. Parents have particular rights over the care of their children that are in violation. So there are many different human rights that are occurring on a daily basis with regard to this marginalized patient community. And one of the most egregious ones is euthanasia. For example, a patient who is very sick, who has had treatment, has been able to receive treatment, but is still sick, is now told, well, we will not cover your care costs, but we will offer you euthanasia. So you're not sick enough to receive care, but you are sick enough to qualify for euthanasia. And we have documented cases of this happening in Canada, the Nordic countries, and the Netherlands. And I'm sure it's happening in more and more places. And there's a risk of it happening also in the United States as more and more states allowed euthanasia laws to take, to be supported. So how can we have a situation where somebody is told that you're not really sick, but you can be euthanized?
That's insane. That's insane.
Yes.
What is it about chronic Lyme that makes Lyme survivors so susceptible to this gaslighting and the marginalization?
That's a very good question. And it's a very complicated answer. So I'll kind of focus on a couple points. I won't be able to cover all of them. But let's take the example of peptic ulcers. For years, for decades, for many, many decades, maybe in a century, peptic ulcers were not considered to be caused by disease. They were considered to be perhaps a personality issue. Somebody had a driven personality, or they couldn't handle stress, or they were prone to psychosomatic illness, etc. Then they found out that, in fact, peptic ulcers are caused by bacteria. Once that was established, peptic ulcers were treated as a disease and treated to eradicate or get the bacterial infection under control. Now, with Lyme disease, we've known since 1981 that it is caused by a bacteria. There's universal agreement that this is what's causing this disease. And yet, the National Institute of Health, with US taxpayer dollars, has funded multiple articles that are published in peer-reviewed journals and disseminated globally and presented at multiple medical conferences across the globe, saying that Lyme disease patients are crazy, dangerous, and should not be involved in any aspect of decision-making regarding policy, practice, and their own medical care. Now, this goes against our federal laws, whereby stakeholders should always have a role in the decision-making of medical care and federal policy. It also goes against human rights violations. But the fact that the National Institute of Health has spent millions of dollars choosing one particular patient group and slandering and libeling them and allowing this to happen, it goes against like everything we know about how the NIH should function, how the federal government should function, and how our medical system should function. And frankly, there are no other medical groups that have this kind of pointed attacks on them. So you have to wonder why that is happening. And it makes really no sense, except that if you look at there could be many reasons, but one or two of them could definitely be related to the costs of care related to Lyme disease. In the early 90s, they found a government study found that the average cost of treatment was $100,000, which is $184,000 in today's money. Now, that's not on an annual basis. That's over a lifetime, which, given its generic antibiotics, you could probably bring the cost down even more. But that seemed like an exorbitant price, and the US government was looking at having to pay this for all the federal agencies, state and county employees, federal employees, military personnel, anybody who works outside who is exposed to ticks could be, on the hook. They could be on the hook for providing long-term care. Mm-hmm. And so there were quiet decisions made both by private insurers and the US government to basically not cover the cost of care. And this is very well documented in congressional records as well as many legal cases.
Yeah, that's insane. I watched a great documentary called The Quiet Epidemic, which I'm sure you've seen, where they do a really nice job kind of documenting the history of that as well. Wow, this is just insane. When I wrote my book, Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know, I had no idea about this. I didn't know so many things, but I didn't know about the political background. And like you just said, there's no other disease where this is a thing. It's like, even like there's no one like you who's fighting for the rights of people who broke their ankles. You know what I'm saying? And I've met tens of thousands of people. You must have met hundreds of thousands of Lyme survivors over the course of all the great advocacy that you've done. We're going through the same thing. This isn't like one person in, Martha's Vineyard. This is like, we're talking like thousands, tens of thousands of people, hundreds of thousands have gone through the same process. They can't get the insurance, they can't get the care. There's so few people who we really understand how to even care for chronic Lyme survivors, if any.
Could I just go on a related note?
Yeah.
For example, the ICD code specifies that Lyme can cause dementia and demyelination.
Sure.
Now,
What does
demyelination?
What does demyelination mean?
That's when the nervous system is destroyed, basically.
Okay.
The nerves are destroyed.
Okay.
So you get conditions like ALS, Lou Gehrig's disease,
Gotcha.
multiple sclerosis, Parkinson-like illness, these conditions where you have neurodegenerative conditions.
Okay.
I myself was misdiagnosed with multiple sclerosis, and the symptoms resolved once I went through long courses of antibiotics, for example. But the IDSA guidelines, the 2020 guidelines, say that based on very low quality evidence, this is their own statement, based on low quality evidence, they strongly recommend not investigating cases of neurodegenerative diseases caused by Lyme disease. In other words, if you have a neurodegenerative disease, do not rule out the possibility of Lyme causing this. This is in their guideline recommendations. At the same time, the World Health Organization is recognizing that it causes this. Why is there this broad disparity? And why would they make a strong recommendation based, in their own words, on low quality evidence?
Yeah.
There's a lot of money being made off of biologics.
That is true. That's a whole different, whole separate thread we can go on. All right. I want to thank Jenna Luché-Thayer again. She was one of the authors of that mass medical gaslighting and Lyme disease, the patient experience. Just FYI, if you're catching this show before we did that show, go back and watch the show that we did with Jenna and her two partners on the book on the report that they wrote and was published at the end of December 2023. Jenna, thank you so much for all this great information. I'd like to continue talking to you about this as we further get down the pike on some of the related topics, possibly when I do version 2 of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. Give us a final thought, a final recommendation for Lyme survivors. Again, you've met probably, like I said, tens of thousands. The work you've done, you've devoted large parts of your life to solving very, very difficult challenges to help this community. Give us a recommendation. Again, most people who listen to the podcast, I originally thought they were going to be the family members, partners, and friends. But what I've come to learn is most of my listeners and people who read the book are Lyme survivors who are looking for more support and finding ways to communicate. So what will be your final recommendation for those audiences?
I recommend that if you have chronic Lyme disease, which has been proven to be caused by persistent infection and possibly other associated complications from persistent infection, that you have a nice package organized that you can put into your file with your doctors. I would include the medical gaslighting article that we published. I would include the information I have on the ICD codes that's been posted in a number of places, because again, that's been validated and ratified by 194 nations. And I would include other key documents that you think are relevant that can basically legitimize and validate your condition. I would also suggest that you negotiate and seek doctors who are willing to treat you when you are highly symptomatic. I myself, I had Lyme for decades undiagnosed. I was misdiagnosed with very serious disabling diseases, and through a couple different long-term courses of antibiotics, I've been able to reestablish remission every time. So there is hope out there, but do not wait for the cavalry to come in and save you. Take proactive action on your end. And also remember, this is a political disease, and we have to organize politically to have the care we need.
Once again, thank you so much for the great advice. Once again, I want to thank Jenna Luché-Thayer for being a guest on today's Love, Hope, Lyme podcast. My name is Fred Diamond.